Hey there, this is Airto, Zamorano with Numana Medical. I'm here with Kate Othus from DataDx.
Hello.
Each of us lead our companies and we focus on helping doctors around the country with a variety of issues that they face in their practice, ranging from healthcare consulting to medical marketing. Today, we want to talk about what you should be doing as things start to open back up. I think it could look different per state, per specialty. There's a lot of things that you could be facing. So I think we should be looking to prepare for all scenarios, be as prepared as we can. Nobody really knows exactly what's going to happen, but I think we can make some reasonable guesses and have things prepared for what could happen. So today we want to focus on preparing your staff for a return. What are we going to have for staff when we open up? What should we do? And also looking at preparations for the volume we might see. We might see a very slow ramp up. We might see an onslaught. What should you do in either scenario? So I want to let Kate kind of open up a little bit with some of her thoughts on this, and then we're going to end this with some action items you can take today. Everyone should be taking. Understand that your peers are taking these in many cases. So we think that it's something, if you're not doing it or you haven't already set a plan, that is something you should be doing. So Kate, what do you got for us today?
We are preparing to see an influx of patients and an increased demand on OR times, but we're uncertain if our staff and our patients are prepared as far as what to expect when our practices and our surgical opportunities and facilities reopen. And so what we're wanting to emphasize today is some simple steps to help set a plan for both your patients and your staff to understand what to expect and how to navigate this potentially very chaotic time.
Right. Yeah, we are having these discussions with all kinds of sides of the groups, right? Different specialties, and the question is the same. Like, people aren't going to have insurance. Are they actually going to come back? Are people on the other side are saying, people are banging down the door saying, I don't want a telehealth appointment. I want to see you in person. Allergy patients in ENT settings are feeling eager to get their treatment. We know, people with hearing loss are having anxiety about when you're suffering from tinnitus. That's a serious issue you need to have handled. So I do think in various settings you are going to see where patients are going to be eager to get care. The question is what volume, and you made some good points before that people might be losing their insurance. They may not be in other settings, right? So it's an interesting thing to have to try and balance. So I think let's talk about some of the action items that people can take. I think one of the first things we're recommending is you do an assessment of what you have today. I think most of our groups have already assessed what they had previously. To put it bluntly, it's been a time to kind of clean house if you had some people that weren't a great fit for your team. We've seen some of that. I think people are running with the essential staff that they need currently. But now we got to start looking at, once we start opening up, does that need to change? Do we need to increase that number? So the first action item is assess your staff that are currently active during the shutdown. Second action item, assess who you want to bring back that you can immediately bring back. Likewise, assess who you want to bring back that you can't necessarily bring back from a financial standpoint. You're not sure if it's ready. Assess where you think you can't, and understand the impact of that. If it turns out that in that assessment you realize, wow, I really rely on this individual, they might have to go somewhere else because they're not employed, you might really want to evaluate then, take a step back about who you can bring back and maybe shift things or find a way. But it is something to at least understand the decisions you're making. Don't just let them happen. Evaluate the impact. Once we have that portion, I thought you brought up some really great points. I'll let you kind of take this next segment about these next action items, because I think now we got that sorted out, the who is coming back, how are we paying for it, what's the plan, what if we have a ton of calls or we don't, and now we've got another set of issues as we start to reopen.
That's right. We need to make sure that our staff is prepared for how to handle PPE, making sure that they're protected well and that they're protecting their patients. And also that they've implemented proper social distancing parameters within their practice. They're sterilizing their waiting rooms, that they have some type of protection between their front desk and their patients, and in the clinical settings as well, which usually those are very properly maintained. But again, there's going to be extra efforts.
So that first action item is take an assessment of your PPE and ensuring that you have a proper amount and access to what you need as things move forward.
Correct.
And then the next one behind that was ensuring that you have strict protocols in training that keeps your staff and your patients safe.
Correct. And then I think the last step is a 2-in-1 punch, and it surrounds insurance coverage. Our patients will have, some of them will have loss of insurance coverage. And then as we rehire our staff, we need to make sure that they're properly covered as well. And so the action item is, make sure that your staff understands that they need to re-qualify all of your patients to ensure that they're insured. And then on the staff side, that they are renewing those benefits and working with their health plan so that they're covered as well.
Yeah, and to reiterate that, individually, you want to plan training-wise in understanding internally, how do we make sure these patients have the coverage that they need? We don't want them coming in without coverage. Well, explain why. I mean, why is that so important from your perspective?
We don't want to transfer any additional financial liability to our patients if they have healthcare coverage, or if they don't have healthcare coverage, we want to make sure that the patients are informed that it's going to cost them X, Y, or Z amount of money to come in and receive care. Having coverage secures the patient and makes them focus on that treatment that they're going to be receiving, and not how much is this going to cost me, and let's do the minimum amount. And so we just want to position the experience for the patient as best as possible.
And you mentioned earlier, when you and I were talking before this also, it's good to make a decision how much we're going to potentially give away, so to speak. What are we going to do just to take care of people without maybe being 100% certain we can get reimbursed for it? So understanding that as well.
That's right. Some practices do choose to participate in charitable care, and they devote a certain amount of a percentage of their revenue to charitable care. Some is, up to 10%. And so if reasonable, they may consider evaluating that number. If they haven't done so before, they would want to do that now. And so if there's patients coming to them that they have long-term relationships with, but they've lost their coverage, they may decide to go ahead and see that patient and write it off to charitable care. And there's, of course, policy and procedures that need to be put in play around that, but it is something to evaluate.
Right. And it's important that the staff understand those parameters too, from a scheduling standpoint, screening standpoint. So I think there's a lot there within that action item, isn't there?
Yeah.
The other one you mentioned being from the employee standpoint, making sure that they have coverage. Now, this could come a couple different ways, right? From a practice standpoint, if you're providing coverage, and how are you making sure your staff stays covered? But what do you do for people who waived coverage, through your organization? Maybe they're covered by spouses. Maybe that changed. So I do think you want to audit that. Your roster should reflect who's covered. Every state kind of has their own challenges, but I think in general, it's great to have that tied to your roster, staff roster, showing who's covered, who's opted out. And by the way, if people are opting out, you have to also make sure you're still compliant with, from there. So it is a good time to go through that. I think it's a really smart point that you brought up.
Thank you. I think it's important to make sure we're taking care of our people. I think if COVID's taught us anything right now, it's all about the people, and ensuring that we have well-being for our staff is critically important.
I agree. So these are your action items today. I think that this is a great starting point. It'll do a lot to get you prepared. There's all kinds of areas with your practice administration we could jump in, and all kinds of ideas we could throw at you. But I think this is a pretty short list that could keep you pretty busy preparing for your doors opening again. Kate, any other thoughts on this? Any last, any things you want to mention?
Just to roll up your sleeves and get involved, show your practice leadership. And if you need help, reach out to us or work with your teams and your advisors to make sure that you have proper plans built. Communicate more than ever.
All right. If you like this video, please like it, share it. There's contact information below if you're on our website, and we will be coming at you guys with some more information as we come up with different discussions with our clients. We're going to keep trying to put ourselves out there just to be helpful during these times. And if you have any questions, don't hesitate to reach out. Thank you again, Kate. It's always good to speak with you.
Yeah, thank you. You as well.
Okay. Thank you.